presented by Escape in association with Patil University School of Medicine, Navi Mumbai. I'm Dr. Akanksha Saberwal, Associate Professor from the Department of ENT, and today we will be getting smarter with COVID-19. The severe acute respiratory syndrome coronavirus 2, or simply put the SARS-CoV-2, is the virus responsible for the current pandemic, and the resulting disease is called COVID-19. Now, this is a novel coronavirus. It's never been found in humans before, which is why we don't have any innate immunity for it, nor do we have an absolute cure or a vaccine. The mode of spread of this infection is via respiratory droplets, especially via sneezing and coughing or being in close contact with an infected person or picking it up from contaminated objects around you. The symptoms of this disease are fever, persistent dry cough, sore throat, loss of sense of smell or taste, body aches, myalgia, and in some cases even breathlessness and hypoxia. For persons succumbing to the severe form of the disease, you may also see symptoms or signs of pneumonia, acute respiratory distress syndrome, and in some worst cases, septic shock and multi-organ failure. Now, thankfully, most of the patients do get the mild form of the disease or are asymptomatic, and they recover within a few days. But for patients succumbing to the severe form, they do require hospitalization and supportive therapy, sometimes even intensive care therapy. Now, as I said, there's no 100% cure available for it yet. So in this case, remember, prevention is better than the cure. These are doubts in a question and answer format about the ongoing pandemic. Now, the Medscape team has come up with a carefully curated list for this very purpose. So let's get started. The first question is, how can you differentiate between COVID-19 and any other seasonal viral infections? Now, this is an excellent question to start with, especially because we are seeing a mix of influenza and seasonal-like illnesses mixed with COVID-19 right now. Now, in COVID-19, our symptoms are usually high-grade fever, and what we experience is more of lower respiratory tract symptoms like sore throat or a persistent dry cough. In a seasonal viral infection, you're probably going to experience more of nasal congestion or a runny nose, as well as headache. Also, in COVID-19, your fever is usually high grade, probably more than 100 degrees Fahrenheit. A seasonal viral infection may not have that high grade fever. To be honest, it is going to be tricky to differentiate between a COVID-19 illness and a seasonal flu in the first 1 or 2 days of developing symptoms. So to be on the safe side, it's better that the minute you start experiencing any of these symptoms, you isolate yourself and you stay away from people so that in case you do have COVID-19, you do not end up spreading it to the others. If your symptoms persist or if you're not getting any better, it's probably time to seek medical advice and get tested for COVID-19. The next question is, what are the different tests available for COVID-19 disease? So right now there are 2 tests that we know of, 2 diagnostic tests. One is the RT-PCR, or the reverse transcriptase polymerase chain reaction test, and the other is the antibody test. Now, the RT-PCR test is basically a test to detect the viral antigen in your body. What it essentially means is, if you have been infected by the virus and the viral particle is present in your body, this test detects that viral particle. Now, usually there's a swab taken from your nasopharynx, that is deep behind your nose, or your oropharynx, and that swab is sent for testing. So a positive test report for an RT-PCR means that you are infected with the SARS-CoV-2. However, a negative test may not necessarily mean that you don't have the virus, because the false negative reports for this test is as high as 30%. It could probably be because the area that you took the swab from, that area may not have had a high viral load, so the test did not pick that up. So usually if you have symptoms, or if a patient or a person has had a contact with a positive person, it's better to repeat the test based on your strong clinical suspicion, just to confirm that the test is indeed negative. The other test is your antibody test.
Now, antibodies are basically produced in your body in response to any kind of antigen or foreign invasion. In this case, it's the SARS-CoV-2. Now, what happens is, just like any viral infection, when you're infected with the SARS-CoV-2, your body produces antibodies. The antibodies produced are two types: IgM, which shows up within the first 4 to 5 days, and the stronger IgG, which takes about 8 to 9 days. So the antibody basically detects the level of these antibodies in your blood. It's a quantitative test and it's fairly very quick. You could get results as quickly as 3 hours. The problem in this test is that you cannot detect an early infection. That means that antibodies, since they're developing only after the 4th and 5th day, the test will be able to pick up the antibodies only after day 5 or maybe later of getting the infection. So it's difficult to diagnose cases in early days. Also, it doesn't tell us whether the patient has an active infection or not. So potentially you could use it in 2 scenarios. A, if there are a lot of asymptomatic people, or some people may have had the illness, a mild form of it, and did not know, and they just want to know and confirm whether they had the COVID-19 illness. And B is if you have a large number of patients coming to the hospitals in, say, day 5 or 6 of the disease, and you need to do a quick diagnosis to confirm whether this patient needs to go to a COVID ward or a non-COVID ward, you could potentially use this test. However, right now, the RT-PCR is the standard test that is used for identification and confirmation of COVID-19 illness. Asked is, what are the preventive measures that we have to take as a general population and also for healthcare workers? Well, everyone has heard about all the preventive measures they have to follow across every medium possible, be it television, social media. It's basically a lot of overload of precautionary measures. Well, frankly, I think that's a good thing. It's important to repeat these instructions again and again so that people don't forget. And it's definitely worth looking at again. So first, wear a mask. Okay, wearing a mask. It's so simple. It is so easy to do, and you have to wear it the correct way. You have to wear it where you cover your nose, you cover your mouth, and it also covers your chin. Please wear the mask the correct way. Okay, there's no point in wearing the mask where your nose is exposed or it's just around your neck. There's really no need of doing that. You might as well walk around without a mask then. Remember one thing, and this dictum is something that I follow personally. When I wear the mask, I protect me from you and I protect you from me. It's a simple thing, but it can bring down the rate of transmission dramatically. And it also helps in following the next rule, which is do not touch your nose, mouth and eyes. I mean, it's so simple, right? When you cover your face with a mask, easily your nose and mouth are covered. So even if your hand is moving around, you'll not really infect or contaminate your nose and mouth, but you've still got to work on your eyes. Now you may think, oh, this is so easy to do, but actually it's not. There have been studies that show that on an average, even a healthcare worker who knows the risk of contaminating yourself touches their face easily at least 19 times per hour. So you can imagine that the amount of times that we end up touching our face subconsciously is a lot. So we've got to reduce that, and that's going to take some effort, which is why we need to keep reminding ourselves of this. The other is maintain hand hygiene. We keep repeating it, and I will also repeat it. Wash your hands regularly with soap and water. Spend at least 20 seconds thoroughly cleaning every part of your fingertips, the crevices between your fingers, the back of your hands, so that if you've accidentally picked up any of your respiratory droplets, infected respiratory droplets, you'll wash them off and inactivate the virus. The other thing to also follow is something that I call physical distancing. There's a lot going on about social distancing, but frankly, it's more of a physical distance. Socially, we're all connected, but it's important to maintain a physical distance of at least 6 feet with another person. Now, of course, there are places where you cannot manage 6 feet, but then at least respectfully maintain 2 feet distance. That's not very hard to do. Simple things like those could help in preventing the spread of this virus. Make sure that you're following respiratory hygiene. That is, if you're coughing or sneezing, you're doing it in a tissue which you dispose of immediately, or if you don't have one handy, do it in your elbow. Of course, if you're wearing the mask, that's even better, so that the mask protects that sneeze and cough from spreading your respiratory droplets elsewhere. So these are simple things, but I think it should be repeated again and again so that we all make sure that we follow it. For healthcare workers, the risk is tenfold. So I think all of these measures have to be followed even more strictly, even more vigilantly. I think it helps, especially for healthcare workers, if you have a buddy system or if you have a team system wherein your colleagues or friends working with you remind you and check whether you've worn your entire protective equipment properly, whether all your portals of entry are sealed, and you're following all those instructions. Because it's very easy to get fatigued, get tired, and forget or miss some of these precautions. The next question I'm being asked by the Escape team is, do I think there will be a spike of infections now that we've lifted up the lockdown, or is it the end time for COVID-19? Look, I would honestly love to give you a very positive answer and say, yes, this is the end of it. We're not, once we pass by June, we're at the end line. But frankly, I don't think this is the end. I think we're just beginning to see a peak, and since the lockdown is lifted and everyone's out and about again, the infection rate is going to go up. What I hope to see is that once we do see the peak, we rapidly follow down. But it is going to be tough because, well, honestly, we are a huge population, more than 1.3 billion in the country. And the infection rates will rise because it's very difficult to maintain social distancing, especially in crowded cities like ours. Mumbai, can you imagine following social distancing in the local trains or the buses? It's tough. So yes, the numbers are going to rise and we will have to deal with COVID-19 for a while. Add to that complication, since the rains have already started pretty much, we are going to see a lot of mix of cases of malaria, dengue, so it's going to be a cocktail here and it's going to be tough. My next question is, since the lockdown has been lifted and the cases aren't decreasing, what is the potential risk we could be facing as a society, and what are the preventive measures we should strictly abide by? Well, frankly, my biggest concern is we as people, not just Indians but world over, we have a very short memory when it comes to tragedy. That's a good thing and also a bad thing. It's a bad thing for an ongoing pandemic because once people start coming out, we want them to remember to follow the rules. We want them to remember to follow all of those rules that can prevent the spread of the pandemic even further. However, you already see people out on the streets, most of them barely wearing masks. There's barely any social or physical distancing. So that, I think, is going to be a big problem. Secondly, India as a nation and as a culture, we're so deeply socially connected. We do everything big fat Indian. Any kind of event, any kind of social function or family gathering, it's always in large numbers. So I think it's also going to be difficult to control large gatherings or social functions so that we can ensure physical distancing. In these cases, I think it's going to be especially important to follow those simple rules like wearing a mask and making sure that you're ensuring respiratory hygiene and washing your hands, etc., to make sure that how much ever we can, we need to prevent the spread of this pandemic even further. Because remember, the end of the lockdown did not mean the end of COVID-19. What is the challenge that India faces as a country as we enter the crucial leg of this battle against COVID-19? Well, I think the biggest challenge for India is our healthcare infrastructure, both for public as well as the private sector. I think India as a country traditionally has not spent enough of their GDP on healthcare, and I think it's finally that time when we do start asking these hard questions. And it's not just the decision makers, it's also we as the people who need to understand the need for better healthcare, more widespread healthcare in our country. So these are some tough questions that I think this pandemic has brought forth. And this is going to be our biggest challenge, because even before the pandemic, our healthcare was bursting apart at its seams. With the pandemic, it's at breaking point right now. So healthcare is something that India as a country needs to focus on more strongly in the future.
This question is quite interesting. It says in our daily conversations we come across many misconceptions about COVID-19, and what according to me is the myth that has struck me the most. Well, this is a controversial question, and I think I'm going to get into a little bit of a controversy here. Well, two things about some of the misconceptions about COVID-19 struck me. The first one was the whole controversy around hydroxychloroquine. I remember the first article in Lancet that came against hydroxychloroquine created quite a stir, and subsequently a lot of ongoing clinical trials were put on pause, citing concerns regarding hydroxychloroquine and it potentially increasing the severity of COVID-19. To me, frankly, that was a little out of reach. I think hydroxychloroquine has been a drug that has been around for so long that its efficacy and safety profile is pretty much already in place. Of course, the effectiveness of this drug against COVID-19 is not yet confirmed, which is why we have ongoing trials to confirm whether it does work. I think it was a bit too premature to disown this drug at such short notice, and I'm really glad ICMR took that stand against WHO and said no, we are going to continue our research into this drug, because the availability of this drug is quite wide, and if it does prove to be effective against COVID-19, it could be easily available to a large population at very reasonable prices. The other myth is it was more in the beginning of the lockdown actually, where most Indians believed that what is this COVID-19? ये हमको तो नहीं होने वाला, हमारी immunity इतनी strong है. Well, unfortunately that's been proven wrong, as we are seeing a rapid rise in infections. Of course, we have a strong immunity and we are a resilient culture traditionally, but I think it's also important to remember that any individual, even in India, could be susceptible to this infection, and accordingly take all necessary precautions. We as a community have to do our bit, individually as well as together, to make sure that we stop this pandemic soon. Congratulate the Medi Escape team for doing such a fabulous job. I think the sheer pool of talent that you guys are uncovering is so amazing. The artwork, the music, everything that you've put up, it's almost like medicine for the soul. Keep up the good work, guys, and I can't wait to see what you come up with next.